DeShazo, director of the UCLA Luskin Center for Innovation. Really a privilege and an honor to be with you all this afternoon. I'm going to make some additional kind of framing remarks in just a minute, but I think it would be great to introduce you all to the UCLA participants and presenters today. So let me just turn it over to, let's do Ji-Sun, Alan, Greg, and Lolly, please.
Great. So my name is Ji-Sun Park. I am an assistant professor at UCLA. I'm an environmental and labor economist by training, and yeah, glad to be here. Excited to share this work with you all.
Hi, everybody. I'm Alan Bareka, and I'm an associate professor at UCLA in the Institute of the Environment and Sustainability. And I'll be presenting on the impacts of climate on early health outcomes, early delivery specifically, and also the presentation on financial distress from climate change.
Hey everyone, Greg Pierce, Associate Director at the Luskin Center, Faculty in Urban Planning. I'll just be saying a little bit about utility debt and financial implications following Alan's presentation.
Hi everyone, my name is Lolly Lim. I'm a staff member at the UCLA Luskin Center for Innovation and serving as the project manager for this effort. And I also wanted to flag Nora Pankratz, who's also on the call from UCLA, who supported Dr. Park on the research that he'll be presenting on.
Yeah, Nora, would you please introduce yourself? You dropped off of my screen. I apologize.
No worries at all, Jaya. Yeah, thank you. Exactly. So I supported the project on heat and worker safety. I will not be presenting today, but I'm here just in case there are additional questions in the Q&A that I could be helpful with. And I'm a postdoctoral researcher at Luskin Center, and also by training financial and environmental economist.
Thank you so much, Nora. All right, should we, Leah, share the screen? Yeah, that would be terrific. So let me just kick things off by orienting you a little bit and providing some context. This is a research grant that we are going to be presenting the results of today. And you can see the title of this grant, Measuring the Impacts of Climate Change on Vulnerable Communities to Design and Target Protective Policies. And we had a portfolio of research that has been funded under this grant. Today, we are going to hear about the first 3 bullets. And let me just say that as a public research university, we're very happy to be able to do research that helps us better understand the impacts of extreme heat and in some cases wildfire exposure to vulnerable groups, and to also be able to conduct research on policies that might mitigate or prevent heat risk exposure. And earlier in the week, Dr. Pierce, who's also here, and Dr. CJ Gabi presented on subsidized and manufactured housing exposure and extreme heat risk and wildfire risk. And they have several papers that I would recommend to you if you are interested in that exposure setting, which I think is an extremely important one for the state. And then later this week, we will be presenting also on an assessment of policy gap analysis for heat risk, again, mitigation and prevention, focusing on state level agencies and state governance capacity, and also presenting a new tool, the Healthy Places Index, the Extreme Heat Edition, and discussing that research tomorrow. So we'd invite you to join us then if you're interested. Let's go to the next slide, please. So the agenda today is really designed to make sure that we have a chance to hear, well, first to present the high-level findings of each of these studies. I will say up front that won't have an opportunity to provide you with a detailed discussion of methods and data and things like that in our initial pass, but we've left ample time for Q&A, and we would invite all your questions. And we will endeavor to make sure that as for the research that's available, you have access to that immediately. And some of the work that you'll hear about will be forthcoming. We'd love to make sure that you get on our listserv so that when that work is complete, you can have access to that as well. Leah is pointing out that if you have questions, let's go ahead and stack them up in the chat box so that that'll facilitate Q&A when we get to that stage. After my remarks, we will turn to heat and workplace injury and the study that Dr. Park and Dr. Pankratz have conducted, and then we'll turn to Dr. Bareka and focusing on the health impacts on child and maternal health, and then come back to Dr. Bareka and Dr. Pierce, who will talk about the impacts of extreme heat on energy expenses and then subsequent disconnections for low-income households in California, which also result in at sometimes quite high utility debt. And then we'll leave time for Q&A. Next slide. Oh, we lost our slides. Is that, Ji-Sung, are you going to present independent of that slide deck?
I think that's the easiest way to do it. Yeah.
Okay.
Why don't I go ahead and share my screen then?
Yeah. So the floor is yours, Ji-Sung.
Awesome. Thank you, JR. And thank you everyone for being here, and Leah for putting this together. Can you all see this? Great. All right. So yeah. So once again, my name is Ji-Sung Park. I must apologize in advance due to a strange coincidence that's only possible in the COVID world. I'm also presenting in another panel that just happens to be at almost exactly the same time, so I'll have to duck out in the latter half of this session. But thankfully, we have one of my co-authors on this project, Nora Pankratz, with us. So any curiosities that I leave unaddressed, hopefully Nora can fill them in. I will be focusing on a particular aspect of the climate problem that, at least based on the data that we've seen, appears to be something that is already affecting our day-to-day lives and is subtle, but as it turns out, economically meaningful and often highly unequal ways. And the agenda says heat and workers. I've added a little bit of a bonus. We're going to talk about students and learning as well, because I think it tees up the workers piece nicely. But let me just start with a couple of stylized facts that I imagine are familiar to many of us, which the first of which is that we've baked a lot of warming into the system, right? And not to put a damper on mitigation efforts, if anything, to underscore the urgency of mitigation, irrespective of what we're able to achieve in terms of mitigation policy, we've baked a lot of warming into the system, at least over the next 3 to 4 decades, given the degree of inertia in the climate system. Some parts of the U.S. expected to experience 50 additional days above 90 degrees Fahrenheit, right, just in the next 20 to 30 years alone. And I just want to point out that this warming comes amid a backdrop of growing economic inequality, particularly wage inequality between those with and without higher levels of education, particularly between those with and without a bachelor's degree. And there's growing evidence that, whether it's globalization and trade shocks, or automation and technical change, or even the recent COVID-19 pandemic, the economic fallout of these shocks appear to be borne increasingly heavily by individuals with lower levels of education, particularly non-college men and underrepresented minorities. One aspect of this workplace inequality that hasn't received as much attention is working conditions, including workplace safety, right? Safety on the job, and just the degree of comfort and pleasantness of a working environment, which temperature might affect, something we're going to return to in a moment. But I also just wanted to point out that, climate change also in some sense overlays on what some might call a generational reckoning with respect to issues of racial and economic justice. One pernicious aspect of which I'm particularly interested in are racial educational achievement gaps, right? These are gaps in standardized achievement wherein Black and brown students consistently perform, 3 years worth of formal schooling behind their white counterparts, at least in terms of standardized achievement. And these gaps have proved to be persistent and highly stubborn despite many attempts at ameliorating them. Okay, so with that as motivation, let me just walk us through 2 sets of research projects that this grant has helped to fund, starting with the work on heat and learning, and then moving on to heat and workers. Let me I just wanted to briefly note that in a series of studies that a number of co-authors and I were able to look at using highly detailed data across the US, we actually found that hotter temperatures appear to affect students, particularly students in schools without adequate air conditioning, in a way that appears to show up in terms of standardized achievement. So happy to go into the methods, if we have time, but using what are called quasi-experimental research designs, where we're essentially lining up the data in such a way that makes it as if nature herself is running a series of randomized experiments on students in the real world. We find that hotter than average years within a given school actually lead to lower than average learning. So, expected amount of learning in a given year, a 1 degree Fahrenheit hotter than average year actually appears to reduce learning by around 1% of what we would expect to occur. That's on average. That masks a great deal of heterogeneity, particularly by race. Black and Hispanic students, for Black and Hispanic students, this effect is roughly 3 to 4 times as large. And we then go on to show that if you account for the fact that, schools in lower income neighborhoods and schools in areas of the country with higher proportions of minority students tend to have lower levels of functioning AC, combined with the fact that racial minority students tend to live in places that experience more heat exposure to begin with, we estimate that, right, these factors alone, the current climatic distribution and its effects on cognitive performance and learning may contribute, up to 7% of those racial educational achievement gaps that I showed you earlier. So this was mainly to underscore the intersections between these higher level issues, and also to maybe plant the seed of intuition that hotter temperature may, in very subtle ways, affect things like cognitive performance in ways that may not be immediately obvious on a day-to-day, but using this kind of data show up in terms of aggregate effects. And that intuition, I think, is going to be important when we talk about workers. I'm going to skip this. So let me now turn to the effect of heat on labor and workers. Just want to again emphasize a very basic point that sometimes may go underappreciated, which is that exposure to what economists would call environmental externalities on the job, whether that's air pollution or extreme temperature due to climate change, is actually a remarkably widespread phenomenon, particularly for workers without a bachelor's degree, right? So roughly 70% of the 100 million or so US workers without a BA report routine, once a week or more, exposure to extreme environmental conditions at work. And this includes, by the way, many indoor occupations and industries. So with that in mind, Dr. Pankratz and Dr. Baer, who's a postdoc at Stanford, and I, we teamed up with the Division of Industrial Relations to look at what is the link, if any, between extreme temperature and workplace safety, namely looking at workplace injuries. And again, happy to go into the details of the methods, but one thing we're able to do here, because of the wealth of the data that we're looking at, is to link daily weather records to zip code day specific injury claims, and actually to not only focus on the subset of workplace accidents of claims that are officially designated as being heat related, but just to look at everything and to ask, on a hotter than average day for a given zip code month, do we actually see a significant difference in the propensity of workers to be injured or report illnesses on the job, okay? And so this figure on the left is just giving us a visual representation of the kind of variation we're using, this quasi-experimental variation in temperature. Again, we're looking within a given zip code month, do relatively hot days lead to relatively lower or higher levels of injuries, right, for that given zip code month, and repeating that across the roughly 11 million observations in our data set. And this figure on the right is showing the main effect. It's showing the relative effect of having a temperature with daily max temperatures in Fahrenheit in any of these ranges, so 70 to 75, 75 to 80, all the way up to 105 and above. What is the effect on injury rates, injury claims relative to a day, in this case, in the lower 60s? And just to summarize the results, we find that indeed a hotter temperature has a causal, statistically significant, and economically meaningful positive effect on injuries. A 90-degree day results in anywhere between 5 and 9% higher injury claims, depending on the specification we use. 100-degree or above day, the effect is somewhere between 10 and 15%. Now, one concern when looking at something like this is whether labor inputs, right, the number of workers and worker hours on the job, if that is somehow changing with temperature, you may expect a mechanical correlation between temperature and injuries. I call this the ice cream vendor problem, where if it's hotter, maybe you actually have more workers, more worker hours on the job. That mechanically leads to more accidents, more injuries. We try to look at this separately. We do not find evidence of the, let's call it the ice cream vendor effect, where hotter temperature increases employment and labor inputs. If anything, we find evidence that it decreases it, suggesting that these estimates are more likely than not, we believe, to be underestimates as opposed to overestimates, at least based on this potential confounder. A couple more results that we found somewhat surprising, one of which is, okay, the effect of heat on injuries in industries like agriculture, utilities, construction, outdoor industries, which I'm showing in this above panel here, maybe not too surprising. What we were a little bit surprised by is the strength of the impact in some indoor industries, namely in manufacturing, wholesale, and warehousing. So that's one result. The other that I think in some ways is surprising, but if you think about it in the context of maybe the cognitive impacts that I was talking about before, or the cost-related channels that if we have time, I'd love to get into, maybe less surprising, is the fact that while we find hotter temperature to lead to a very large spike in heat illnesses, so claims that are officially tagged as being caused by heat illness, heat exhaustion, heat stroke, etc., we also find that hotter temperature results in a significant increase in all other types of injury claims. So these are things like a construction worker falling off of a ladder, a manufacturing worker getting his or her hand stuck in a machine, being struck by a moving forklift, right? These kinds of injuries that are ostensibly unrelated to heat nevertheless appear to be more frequent on hotter days. And this is where what researchers call the large N small beta problem really bites. So even though the marginal effect of temperature is not as big, right? Because it's spread across such a large swath of injuries, many hundreds of thousands of injuries of this ladder variety in California every year, the total effect is quite large. So just to give us a sense of the magnitude, relative to a world where all workers in California are fully protected from hotter temperature. Now it's a counterfactual, this does not exist, but just as an informative thought experiment, we estimate that hotter temperature leads to anywhere between 15 and 25,000 additional workplace injuries per year in California. Again, relative to a world in which all workers either experienced, optimal cool days all the time, or were fully protected from hotter temperature. There are studies that estimate, what does a workplace injury that is serious enough to be reported to workers' comp do in terms of damages to the worker, damages to the employer, and to society at large. Think of healthcare costs, lost wages, lost productivity, retraining and replacement costs for the firm, et cetera. Using those estimates, we estimate that the social costs of these injuries and illnesses is on the order of $750 million to $1.25 billion a year. This is in California alone. Okay, I think I'm quickly running out of time. And someone please stop me if I have gone over my allotted time. But I just want to maybe flag two other components of this. I led in the introduction with the motivation with regard to labor market inequality, wage inequality. Well, it turns out that hidden under the headline wage inequality statistics, there appears to be growing inequality or inequality in what you might call non-wage compensation. In this case, the propensity of workers to be injured on the job to begin with is higher for lower income workers. But in addition to that, for reasons that we can't necessarily comment on in this paper, but will be consistent with other work, lower income individuals tend to live and work in places that experience more hot temperature on average. And the marginal effect of hotter temperature on injury risk in percentage terms appears to be similar or possibly slightly larger for individuals in lower income groups. We do this by quintile, which combined suggests that, the average sort of welfare impact of hotter temperature on workers, at least in terms of workplace safety risk, it appears to be much larger for those at the bottom end of the income distribution. Last thing I'll point out is that, at least some of these injuries and illnesses that are caused by heat appear to be preventable using existing technologies. Now, again, if we have time, we'd love to go into this part of the analysis. But the short story is we find that, let's call it the heat sensitivity of injuries, the additional percentage increase in workplace injuries due to, say, a day above 100 degrees, appears to have fallen over time during this study period and remain persistently lower. Now, the drop coincides with the implementation of the California Outdoor Heat Illness Prevention Standard. Again, for reasons that I don't have time to go into now, we hesitate to attribute this reduction entirely to the standard given the data that we have, but certainly the patterns that we see would be consistent with the standard having had some effect, at least in some industries. This is a question that the team and I are really interested in digging into more deeply. But the bottom line is, we find evidence of a very large effect of hotter temperature on workplace safety, but also scope for adaptation, at least in terms of how that relationship has changed over time within California. So let me stop there. And Lolly, are we doing Q&A now or we're moving on?
Yeah.
Sorry.
Oh, I was going to say, since you have to hop off, maybe you can field just a couple questions before you have to go. I think we're okay on time.
Yeah, let's do 5 minutes of
Awesome.
Q&A now. Yeah.
Folks, feel free to jump in and unmute yourself.
Ji-Sung, you might want to stop your screen share so you can
sorry.
see people.
Hi, this is Linda Helland with the Department of Public Health, and I just want to thank you for that shocking, horrifying, but not altogether surprising research. This is some of the most useful research I've seen in a long time, more applicable to our work than a lot. Hoping you can get funded to deepen and continue these kinds of analyses, and that we in the policy world can translate these kinds of findings into policy applicable tools in the policy field, we really love tools that we can put scenarios into and then click a button and get the potential health impacts with monetization, and if it's relevant, emissions impacts, but in this case, probably not. And also really wanted to thank you for bringing up income inequality and other forms of inequality. I've long thought that has been a very neglected space in the climate world. In addition to inequality, as you discussed, leading to disproportionate climate impacts, it also leads to lots of other health inequities, social problems, and now we have very good evidence showing that income inequality is causally linked with communities not being able to collaborate and work together sufficiently to set and meet ambitious greenhouse gas reduction and other environmental targets. So just a plea for us in the state to take on inequality as a climate, addressing inequality as a climate strategy. If you want to discuss any of that, thanks.
Yeah, thank you, Linda. Really appreciate those comments. I could probably go on for many minutes, if not hours, about the issues you just raised. But let me just say, yeah, my armchair observation has been that in the climate space, we've appreciated the cross-country dynamics of climate inequality for a very long time, but the within country, often even within city dynamics of inequality and impacts appear to be less, first of all, less well understood from a research standpoint, and less appreciated. And that's part of the motivation behind this work. I know that's another piece of the motivation behind Dr. Bareka's work on utility shutoffs, for example. So yeah, I mean, a lot of work to do, not enough hours in the day. Let's just put it that way.
Ji-Sung, you have 2 questions in the chat box.
Oh, great. Okay, so Leah asks, what next steps would you like to pursue, and especially on potential adaptations and how we could support at the state level? That's like a, what do you want for Christmas question. Why don't I think about that while I read the other question, which is, have there been efforts to disaggregate data to separate individual occupations according to how likely they are to receive guidance on heat safety, or how likely they are to feel safe in seeking medical care? For example, construction workers employed by a public entity have much different work conditions, and folks employed through a worker center, which have much different work conditions than day laborers without access to a worker center. Great question, Christina. Thank you. Let me see if I can dovetail them, because my answer to the second one is in part an answer to the first. So we are currently working on a project that tries to quantify the degree of heat exposure faced by different occupations across 700 different occupations, and then doing that by race, gender, ethnicity, etc. We're working on that. But an additional piece that I think is interesting, has not been researched yet, is how the effects of heat or any other environmental stressor on workers varies by labor market conditions. So what I mean here is, if you think of the pure vanilla economic model of labor markets that are perfectly competitive, a heat wave strikes, or that climate change is coming down the pike, the workers are in this pure vanilla model able to costlessly, immediately, frictionlessly adjust either their work behavior, their work timing, or switch occupations entirely. We know from COVID-19 experience that adjustment is not frictionless. And so trying to understand how labor market conditions generally, things like monopsony, right, and labor market power affect workers' ability to bargain for or themselves adapt to climate change is something that I'm super interested in. We're just getting started on. And so that would be one of the items, Leah, that I think would be really important to look at. Let me just put it as the intersection of market imperfections, particularly in the labor market, but more broadly, and climate impacts, how these things interact, because I think that informs, from a policy standpoint, the particular levers that policymakers may be able to pull with most effectiveness, right? Some things the market is good at on its own, other things are clear market failures that if they're standing in the way of adaptation, there will be a clear economic case for intervention. I think I'm, previewing also some of the work that Dr. Breck is going to show in terms of utilities. But that's a partial Christmas list. We don't have time, though. I'll just leave it there.
Can I ask one more quick question, or I think it's a quick question? I know you worked with some partners, and have these results been shared? I'm just curious how it's been received, and if you've, any insights in kind of like the on the ground side. Because I think some of us are like, oh, what do we do about this? And hearing from that side could be really enlightening. At least I think it could be.
Absolutely. So I have to thank, Glenn Shore for, making the initial connection to workers' comp, and also David Horning. We've interacted a couple of times to think about what this means for Cal OSHA. I won't pretend to know what it means, but I've certainly benefited from our conversations. And yeah, we've shared preliminary drafts with the Division of Workers' Comp. We're currently trying to extend our agreements so that we can continue working on this and probe other dimensions of it. I don't know if that answers your question, but for example, talking to David about what Cal OSHA has done and is trying to do in terms of the standard has certainly informed how we think about where to look. And what kinds of hypotheses to test too.
And I think, Leah, to speak to your question as well, of course, the indoor heat exposure rule is in development. And I think Ji-Sung's and Nora's work has implications for understanding the importance of that exposure setting in the broader regulatory landscape. And, Ji-Sung hasn't been so bold as to suggest policy solutions, but I suspect he will get there eventually.
Yeah, that's exactly right. We're trying to be the results are still somewhat preliminary, and so we're trying to be cautious about the policy implications, but certainly that's something that we're thinking about.
Thank you.
Okay.
So, thank you so much, Ji-Sung, for making time. Nora, thanks for your hard work on this as well. We're really, really grateful to have your research contributions to this effort, and glad SGC has supported those. Alan, why don't we turn it over to you?
Hi, everyone. Excited to share some lessons from my research looking at the impacts of extreme temperatures on early deliveries. So the idea being that it's hot outside, children are sort of induced into labor and born a little bit early, and that has implications for public health. So I think the importance of this research is obvious and talked about a lot, but I'm going to restate some of those things. And I think there's an indirect benefit of this research in our efforts to sort of address climate change that I'll mention as well. So in terms of just sort of the obvious ones, that there's a lot of research out there indicating that gestational length, so the time in utero, is important for infant health and potentially longer term health for those children impacted by shorter gestational lengths. At the extreme end, when people are talking about gestation, they mention a lot like preterm delivery, which just means that the child is born earlier than 37 weeks, and most pregnancies are sort of like coded as due when they hit 40 weeks. That's really 39 or 40 weeks. But there, and the implications of being preterm include like infant mortality and congenital defects. I'm going to include all sorts of impacts on gestational length. So I also want to highlight the fact that those are extreme outcomes at the preterm side of gestational length, but there's research suggesting that being born even a couple weeks early has implications for child health. And there's associations between what I'll call is early delivery, so right around 37 or 38 weeks of gestation, with those children having higher rates of asthma. And so all these things could translate into the sort of the long-term welfare for those children impacted. But I think there's also like really an indirect benefit of this research, and to not I don't know how to say this in another silly way than just to say it, which is that people really care about children, and that they care about not only their own children, but they care about others' children. And I think there's some successes on this project that I think are worth sharing in that regard. In that this research, documenting a link between extreme heat and early deliveries, I was published in December 2019 in Nature Climate Change, a prestigious journal. And it was the 15th most cited paper talking about climate change in 2019. It was published in December of 2019. This has been one of like the successes of my career, and it was picked up even by 4 senators, so Feinstein, Markey, Blumenthal, and Warren. They sent a letter to the CDC sort of citing our research that documented that extreme heat potentially causes up to 25,000 babies to be born earlier. So I think there's we care about protecting vulnerable children aspect of this research, but I also want to tout that maybe as a sort of like a side benefit of research, this is like an avenue for sort of grabbing people's attention about climate change. And I'll make a plug for a colleague's work who's looked at who did a randomized experiment with different marketing messages around the importance of conserving energy. And one of those marketing messages was, it's good for child health. And they found, and they have amazing data on the energy use of their appliances. And they found that when they randomized people to get marketing messages related to like the benefits of, hey, if you reduce, energy consumption, that'll reduce emissions, that'll have benefit for infant health, that they found that those households had the largest reduction in energy use. So I think that in addition to just sort of the obvious important impact, protecting vulnerable populations, protecting vulnerable infants, especially those, communities of color that are less likely to have access to air conditioner, are more likely to live in warmer parts of the city or more warmer states, that there are these side benefits. But let's get into the research about how we arrived at this 25,000 babies are born earlier because of climate change. And I think the link starts at a really hormonal level. There are animal studies showing that at least in sheep, that when they're randomized into sort of the stressful, hot environments, that their oxytocin levels spike. And oxytocin is also known as the love hormone, and it's thought to trigger delivery in humans and delivery in farm animals. And I should note that a lot of my anecdotes about why heat might impact humans comes from these types of animal studies where they do these experiments because of the commercial value on livestock. But I would love to see more experiments. But I should say also that those animal experiments are still, they're kind of scant, and I would like to see more animal experiments thinking about the mechanisms through which extreme heat impacts human health. But this is just one of the ways extreme heat might lead to early deliveries. Extreme heat is also, affects people's behavior. So it could cause pregnant women to be more likely to stay indoors. It causes cardiovascular stress. Your cardiovascular system is working always to regulate, your temperature. So those are some mechanisms through which a temperature might impact early deliveries. In terms of research on humans, so there are quite a number of existing studies, but those do focus on preterm delivery, and I'm going to be sort of lumping all babies together, thinking about how much our delivery shifted early for the entire population across the U.S. and in California. And also those studies, they focus a lot on really what I would consider as like small populations. So they'd like look at maybe like say Chicago, Brooklyn, Montreal as each as an individual study. So it's not clear to the extent that these findings necessarily generalize. But again, they focus on preterm delivery, and I'd like to sort of just include all deliveries together in a bigger data set. And also I should mention that they focus on deliveries and births where they actually have a gestational length. And I think one of the innovations of this particular project is that the method we employ, you can use this to sort of document the health impacts in terms of lost gestation from extreme heat exposure without even having gestational length, which is sometimes not recorded on the birth certificate. To record gestational length accurately, you actually need to know the date of the last menses for the woman. And with recall bias, you would suspect that's going to be a noisy measure, but sometimes it's not collected at all. So it's important to have like this additional method to build off of those studies, just in case you want to study a population that doesn't have gestational lengths recorded. So what we do, and I think part of the thing that caught a lot of people's attention was just how big our data set is. So we took birth records from 1969 to 1988 for the entire US, which was 56 million births. There's about 4 million children born every year in the US. And so over this 20-year period, we get to a fairly high number. In some years, there wasn't a full sample. They took 50% samples from some states. So that's why we got at the 56 million birth number. But we also looked at California, where there's at least 7 million births. And this is by far the biggest data set that anybody had used to look at the impacts of extreme heat on early deliveries. So we take those birth records and we really, the key variables of interest in this data are the day and the day of birth of the child, as well as the county of residence of the mother, because we can use those to match to the weather station data. So we have daily weather records from NOAA, from the Global Historical Climatological Network. And there's about 3,000 to 4,000 weather stations across the US, and that's pretty good coverage. And we assign weather to the county and the day just by looking at the weather stations. They're sort of within 100 miles of the county centroid. And the basic approach, or the idea behind like what we do, is to look at whether it's hot today and whether we see a spike in birth rates today in that particular county. And that's right, I said birth rates. That's the actual outcome of interest, even though ultimately we care about gestational length. And so let me walk you through sort of the intuition about why you can back out from birth rates, or observe changes in birth rates, why you can actually back out the lost gestational length. So let's take 3 scenarios. The one where a child is born 1 day early because of extreme heat. So let's just say that today is day 0 and it's really hot out. And when I say 1 day earlier, I mean 1 day earlier than it would have been otherwise. Maybe it's 1 day early. It would have been born, like at 37 weeks and 3 days. Now it's 37 weeks and 2 days. But so if we're looking at the birth rates and we're trying to like tracking unusual shifts in the birth rates, we'd see a spike in birth rates today. But if it's 1 day early than it would have been otherwise, oops, let's see here. Then tomorrow we should see a fall in birth rates. Okay, so birth rates can tell us if there's any shifting going on. Suppose it was 2 days early, we'd see in a scenario B, birth rates spike today, and then 2 days later, a drop in the birth rate. But it's possible that it's not all happening sort of contemporaneously, like all births are born today. There could be a slight lagged effect. Say there's some delay in when between the onset, or sort of the trigger from the extreme heat, and when women actually deliver, that maybe they'll be more likely to be born tomorrow, but they're born a day early tomorrow, and they would have born day after tomorrow. It starts to get a little confusing. But so what we would observe then in that case is that there's a drop in births 2 days later. So let's just take the case where we have all these scenarios playing out in the data. What would we actually see on net? Because we don't actually observe individual births and when they would have occurred otherwise. On net, what you're going to observe in the data is, okay, summing up over all 3, is that we see more births today and fewer births 2 days later. Sort of the cool thing about this approach is we can actually, by looking at these sort of shifts up and then shifts down, you can actually back out the correct number of lost gestational days just by looking at the cumulative effect going forward, adding up the estimates from sort of like left to right, or from today, like into the future. And we can also get a pretty good idea of how the number of births affected by just looking at the spike in birth rates today, but we may not capture all of the early delivery is if there is some like delayed effect, and there's some, you know, like mix, like in scenario A and scenario C, maybe canceling each other out to some extent. So now that you got an idea of like how this operationalizes, I'm just going to show you the estimates and what you're going to see. So the estimates are going to look exactly sort of in spirit of this table. So, but over the 20-year data period that we use in our sample, and the 56 million births, we saw that today, and so the gray line is sort of marked at when the hot weather is occurring. What is the change in birth rate on that day? And we see that there's one additional birth per 100,000 women between the ages of 15 and 44. And we also actually see an increase in births on the following day as well. And this kind of makes sense from the fact that, you know, all deliveries, you know, it's not immediate once the oxytocin kicks in, that the, you know, labor and delivery could take several hours, and it could easily go into the next day. But what's interesting also is that you see on the second day, so 2 days after the extreme heat event, you see a decline in the birth rates. And this is indicative of that shifting. So from these estimates right away, you can back out a lower bound of the number of births impacted. So taking the estimates from day 0 and day 1, we get that each hot day in the US causes about 800 births to be born early, but there's about 30 hot days, and those are days that I consider to be over 90 degrees Fahrenheit, when the maximum passes 90 degrees Fahrenheit, that you see. So over 30 days, 800 times 30 gets to about our 25,000 number figure of how many births are impacted. I also want to draw your attention to the fact that a lot of the estimates, say going past day 2 into the future, you'll see that they're sort of like slightly negative. So especially if you look out like right out to here, that those estimates are actually negative. So that's indicative of shifting. No, they're not all like sort of statistically significant or different from 0 with, we can't say with much statistical confidence. But if you start to add them up, it gets you a picture of how long it takes for all the shifting to occur. So if you go and graph out the cumulative effects over time. So that's that cumulative in the table, the bottom row, that allows us to estimate the lost gestational lengths. You can determine that the births sort of were recovered or finished shifting by about 2 weeks after the extreme heat event. But on average, if you take all the fact that, you know, we think that about 800 plus births are impacted by each hot day, that it works out to about 6 days on average per birth. So the average birth is is shifted forward about a week. A lot of births shift forward just by, you know, a day or two, but some takes up to 2 weeks in terms of the shifting to finish. When we focus on California, there's some good news and there's some like news sort of to spark interest in future work, which is, the good news is the results are mostly consistent. We do see that the average gestational lock, so here's the cumulative effect graph that I just showed for all the US. This is just specifically for California. The cumulative effect graph is roughly similar. It takes about 2 weeks to recover all the births. But what you're seeing is fairly large confidence intervals, just implying that our estimates are rather noisy. So while I tout the benefits of this approach to sort of isolating and teasing out the impacts of extreme heat on gestation, it does require a good bit of data. So this was a bit noisy in the California data. But the good news is that we actually applied for and got historical birth records going back to 1907 for California, with information on the day of birth for each individual in the sample, as well as the county of birth. And remember what I said, this approach, now that we validated it, this approach can allow us to infer losses of gestational length, the impacts of extreme heat over time in California. So this historical study will hopefully also provide some big picture insights into, say, like what groups or what periods of time we were especially vulnerable to extreme heat. There are some, so that's for future work. There are some other important results I'd like to highlight in this work, and I'm happy to send along a paper afterwards, since this has already been been published, that that we do find larger effects for Black women than white women due to the fact that Black women have been historically and in modern time discriminated against. We do see also that nighttime temperatures matter more. And when I say matter more, at least in terms of the estimation. So they're just better predictors of this, of early deliveries than say max temperatures, which we use as by sort of our starting point. Everybody likes to talk about extreme heat in terms of the max temperature, but I think that's maybe unfortunately shifting the dialogue somewhat away from the importance of nighttime temperatures. And there's an interesting study showing that nighttime temperatures matter a lot for sleep. And if that has implications for human health, then that's something important to know. It's also maybe important to know for thinking about adaptation policies where, you know, cooling centers might be a great way to protect people from the heat. But if nighttime exposure matters a lot, then the cooling centers may not be able to serve people in those regards. And so thinking about other ways. And then also finally, I should note that when you look at where air conditioning is more prevalent, you do see smaller impacts. So just to recap, we see that about 25,000 early births in the US brought on by extreme heat events with an average of about 6 days. The numbers for California are mostly similar. Taking our population into account, that's about 4,000 early births per year in California. And air conditioning seems to potentially mitigate that risk. So I'd like to pause here, maybe take a few questions. I don't know how we're scheduled on time, but I think probably, I'm guessing just a few minutes we have. Yeah.
Well, Alan, I think given that we only have 25 more minutes and we still need to get through the financial impact analysis for energy and water, maybe my suggestion would be that we move on to those results and then follow up with whatever Q&A we have afterwards.
That sounds great. Okay, and I'm also happy to afterwards to field questions via email. If things get cut off short, just make that known now. You can find my email address on UCLA's website, Alan Barreca. Okay, so moving on to this second project, which is sort of, I think in the evolution of my career, I've spent a lot of just like with this last study, spent a lot of time documenting who is vulnerable, how are they vulnerable? So pregnant women, say, vulnerable to extreme heat, and that leads to early deliveries. What can we do to adapt? Seems like air conditioning is useful in the adaptation process. At this next, I'm moving into what I think of as a new phase that I'm really excited about, which is to think about how are low-income communities uniquely disadvantaged in the adaptation process. And this is something that caught my eye just from a Federal Reserve survey that was done on a totally unrelated topic, just saying how people there's a large portion of the population that just really can't handle fluctuations or unexpected expenses. And climate change is likely to bring lots of fluctuations and expenses with extreme heat. And that's because we need heating and, well, really cooling to protect ourselves. And these are costly necessities. My ballpark estimate of what an air conditioner, like a window unit, would cost to run in California for say 10 hours would be $1. And that's just one window unit. If you have, maybe a few window units, you start to get maybe something like $5 a day. And if you had central AC, it might be as much as $10 a day. And so that can be really costly for low income households. And you're kind of putting low income households in this uncomfortable choice where now the choices are to protect myself from extreme heat, like I've documented in this past study with pregnant women or even the elderly. You have to protect your health from extreme heat, or run your air conditioner and incur potentially an insurmountable energy debt burden. And it's also really hard to track your energy expenses, so you could potentially get hit with an energy bill that is quite surprising. and then struggle to pay that bill, that may eventually lead to disconnections. And disconnection is, I think of as a very costly outcome for households. Disconnection, according to sociological studies, like it's disruptive to the household. It disrupts schooling for the children. There's a costly process of trying to get reconnected. So all of these things make disconnection a really, really extreme outcome. And there's a lot of evidence to suggest that households really work very, very hard. And I think that's something that other households, like mid and high income households, don't have to incur as we try to adapt to climate change, is these efforts just to avoid disconnection, like all the bill struggling strategies that people go to. And as extreme as like avoiding consuming like other necessities like food. In a national survey conducted by the Energy Information Administration in 2015, they found that 22% of households decided to forego other basic necessities in order to pay their energy bill. So to me, this strikes at two things. First, it's a very pervasive problem. In the same survey, 14% of households also mentioned receiving a disconnection notice at some point. This is for the entire US. So 14% received a disconnection notice at some point. So it's a pervasive problem, but the disconnection is, as this interviews suggested, is a very drastic outcome that people do their best to avoid. And despite all this fact, we do actually experience quite a few disconnections in the US. And I have data for California from a report from Southern California Edison to suggest that 0.7% of all residential accounts were disconnected on average in each month in 2015. That's a little bit higher than the sample that I'm going to be using today, but I'll explain why that's the case later. So I'm going to be trying to draw the link between extreme temperatures and disconnection risk using a low-income population in the Southern California Edison territory between 2012 2017. There are two basic questions that I'm after, and a third optional question that I'll get to. But the first question is, do low-income households actually use more energy? And I think that's just a basic first step in the chain of events. Do they use more energy when it's extremely hot out? And the answer is yes. And then do they experience subsequent disconnections after incurring those higher energy bills? And the answer is also yes. And I want to draw your attention to the question two, that, and emphasize the word subsequent, because it's not an immediate impact of extreme heat on disconnections. And that's going to play an important when we see the estimates a little bit later. But the process in Southern California, for Southern California Edison, goes something like this. So there's hot weather in a particular period, and you consume more energy, and that leads to a high bill. So when the bill ends, that the next day is considered day one. Right. And that's the day that the SCE will typically send out the bill. And it arrives like within 1 or 2 days for most households, I'm guessing. But that the postmark date is like sort of the counter for when, the timing, when households have to pay the bill before getting disconnected. So the due date is really the day, day 19. But then if households don't pay on the next bill, they'll get an overdue message. So that's about like 30 days later. Most billing periods are between 27 and 33 days. And then if it's still not paid by, say, like day 41 or 46, that's when SCE starts doing its due diligence to try to, let people know, hey, this is serious, you face potential disconnection, and they'll call, and they'll also mail final notices. And if the household still hasn't paid, then they're the disconnected. And then of course, there are some exceptions to this in some special needs cases where if there's medical emergency and medical reasons for why power is needed in the household, then SCE is, under law, is unable to disconnect those households. But just thinking about that timing is important for thinking about like what are we going to observe in the estimates? Also, like the timing could also reveal like who and how people are impacted. You could imagine that a household's still carrying a lot of energy debt from a previous bill, and they get a high bill right away, like say on day one, but they've still got an overdue balance from before. You could see a disconnection like as soon as maybe like 20, 30 days from the end of a particularly bad extreme heat event. But if you see disconnections like later than say like 50-ish days on, then that's suggestive that the households aren't paying that particular bill for the extreme heat event. Thanks to some rules by the CPUC, energy providers are required to give data to researchers like myself. So we negotiated with them and we were able to obtain data from 300 zip codes with the highest number of accounts, low-income accounts, and I'll talk about how we define low-income in a second, and 1,000 accounts per zip code, so at least 300,000 accounts in our sample, and we chose accounts that were at least active for 12 months, so we had enough data to work with. And the exact timing of our sample is January 2012 to 2017. The sample area for Southern California Edison is shown in this map in gray, but our sample, the 300 zip codes, the ones that are generally just more populous, those are going to be shaded in black. But we do have, and the reason why we did stress with SCE that we wanted a large geographic area, and that was the focus on having, say, like a large number of zip codes as opposed to like a high like sample percentage of like particular zip codes within like the Los Angeles area, for example. So, you know, we have Tulare in here, we have Los Angeles, we have Palm Springs. All of these places exhibit fairly different weather patterns, which really facilitates statistical power when you're trying to actually estimate something, that you can actually get somewhat confident in your answer.
Alan, I just want to alert you, we have a hard stop in 18 minutes. And I think Greg needs 5 to 10 minutes. So if there's any way you could jump to the findings, that would be helpful.
Deal.
Okay. I only need 2 to 5. So
okay.
Just
deal. So we sampled on accounts. I'll take 4 minutes from here on out. That's my promise to you. So we sampled on accounts that were on either CARE or FARA. These are low-income subsidy programs for California, and the CARE program is more generous and it provides a 30% reduction in energy expenses. Well, FARA, at least the time of our sample, was 12%, even though right now I think it's 18%. CARE also is for lower income households. It's up to 200% of the poverty line. So say something like $50,000, an income of $50,000 for a household of 4. Well, FARA only goes up to 250% of the poverty line. All right, so let me just jump ahead and first make the case that temperature in our low income sample, that these households are in fact incurring a large amount of debt. And so what we find is a very U-shaped relationship between temperature and electricity expenses. And that say like a day of that's max temperature is 95. Each additional day in that billing period will raise the bill $1.60. And 95-degree days in at least in this area are relatively common. In the summer months, there's like 12 of those on average. So that's fairly common amount. So we're talking of fluctuations of in the $20 range, which is fairly significant for these households. Now the next thing is to look at the impact of those high bills, those hot weather events, and how do they play out over time in terms of the disconnection risk. So you could think about this. I'm glad like my 2 papers are stacked together, because you can think about this much like we did when we were looking at early deliveries. Like how does a hot weather event today, like how does say like a day at 95 degrees Fahrenheit, how does it like affects disconnection risk, like next period, the period after that, period after that, period after that. And I break it up into 25-day bins. And this is to sort of just highlight the fact that we really only see one bin where hot weather has an impact. And that's when the 51 to 75 days after an extremely hot billing period, we see a spike in disconnections. The magnitude is about 3 disconnections per 100,000. And that's actually, it's kind of a small absolute number, but then keep in mind 2 things. This is a very extreme outcome. And this is the effect of only one hot day. And as I said, we experience about 10 hot days, at least 10 to 12 hot days per average during the summer months. But nonetheless, one day, if you want to translate it into dollar amounts, this is suggesting a very responsive relationship in terms of dollars to relative risk of disconnection. If you do the calculations, you'll see that $1 increase in bill amount translates roughly to about 0.8% increase in the relative risk in disconnection. And then part of that is driven by the fact that disconnections are somewhat rare, but the relative risk that this dramatic of an increase, I think, is somewhat eye-catching to me. Now, I also want to point to some additional analysis that we don't have time today to chat too much about, but there is some question about what is driving this. Is this expenses, or say like in Ji-Sung Park's work where he shows that extreme heat can affect your labor productivity, your injuries, or possibly your labor income? We wanted to dig harder into this. Is it the electricity expenses itself, or is it something else? So we focused on a period where electricity expenses jump, but not likely much else for these households. So there's this interesting policy wrinkle with those accounts that are on care, that after 2 years on care, those households are actually have to re-verify that they are in fact under 200% of the poverty line. And after that point, you observe a stark drop in counts that are actually enrolled in care. So you see a huge unenrolled fraction. So 20 percentage point reduction in the number of households that are enrolled in care. And what happens right after that? You see this disconnection spike. So the spike in energy expenses there leads to a large spike in disconnections, all suggestive that energy expenses matter. And this care experiment that we have here just is further evidence that fluctuations in energy expense are very threatening to households. And I think that's the main lesson here, is that we've already got, for Los Angeles, we've already got fluctuations in energy expenses throughout the year, and this is going to tax households that have trouble saving. But these other events that add to those fluctuations, like extreme heat events or falling off of care, really just only magnify that seasonality and that difficulty. So that's all I have for now, but I'm going to pass the baton over to Greg, who's leading up the team in Luskin working on water debt.
Yeah, thanks, Alan. So I'll be really brief here, but just say that Luskin Center is working broadly, really across the utility space, water and energy, on issues of affordability. And we have turned our focus especially to assisting the state, both the state water board on its estimate of water debt, currently, well, as of a few months ago, estimated around $1 billion in California. And also using the estimates from the State Water Board and the PUC on both the water and energy side to highlight disparities in levels of debt, both in LADWP territory, as well as PG&E territory. And the PG&E analysis just came out today. That work is all very engaged with utilities, community-based organizations, and state agencies, and has helped, at least on the water side, inform the allocation of $1 billion through the governor's, I think, today closing budget to relieve water debt. Next slide.
That's it. That's your slides.
Oh, okay. Well, the next slide is focusing on really, I mean, given that we currently have moratoria on disconnections, and Alan's motivated, some of the implications of disconnections here, but I think both on the energy and water side, there's momentum and commitments toward, even as the moratoria expire, going away from disconnection as a primary policy and looking to whatever extent possible at alternatives that also allow utilities to remain financially whole. So we were working both, again, on the water and energy side with the Water Board, SoCal Edison, and others on what solutions, internal utility policy solutions work to, again, reduce, if not eliminate, disconnections as a policy wholesale, but also allow utilities to recover the revenue they need to operate sustainably, including debt management plans, changes to rate structure, and things like flow restrictors on the water side. So if you're interested in any of that, please be in touch with us. My name is, again, Greg Pierce. You can find me on the UCLA Luskin website, and we're happy